be here because I just really haven't been feeling right.
Okay. Well, my name is Savannah. I'm a psychiatric nurse practitioner student. Okay, I'm going to go ahead and do your intake assessment here and get some information and see if we can't help you.
Okay.
Okay, so first, can you just give me your name and date of birth?
My name is JT and my birth date is January 2nd, 1983.
Okay, great. And can you, in your own words, tell me a little bit about why you came in today?
Yeah, just for the last 6 to 8 months, my son went off to college and I just thought I would just, have so much freedom and kind of reinvent myself and have more time to do what I want to do. But it turns out I just feel kind of purposeless now and lost. My mood is low, my energy is low. I just feeling kind of helpless, hopeless.
Okay. So you said about 6 to 8 months since your symptoms began?
Yeah, it's been about that long.
Okay, and kind of everything kind of started to get worse when your son left for college then?
Yeah, it was a big change for me.
Okay. Do you notice that there's anything that helps with those symptoms or those low feelings ever? Or do you kind of feel like nothing's really bringing you out of it?
No, I mean, some things will work briefly, maybe a little exercise or going out for coffee with a friend. Then I just find myself, coming home and within an hour or so, I just feel the same.
Feel really low again. Okay. Okay, so I'm just going to review some symptoms with you. Tell me a little bit about your sleep.
It's terrible.
Okay.
And I'm always tired, but when I try to sleep, I just can't. I'm staring at the ceiling and I'm worrying and worrying.
Okay, so really low sleep. But how many hours a night do you think you're getting?
Maybe 3 or 4.
Okay.
And I might sleep an hour in the day if I can, but it's restless sleep.
Okay. And you said you're having some feelings of depression. On an average day from 1 to 10, what would you rate that depression? 1 being very little, hardly noticeable, and 10 being the worst you've ever felt.
Oh, an 8 probably. It's pretty bad. It's
okay.
Like a bleakness, like a black cloud over my life.
Okay. Now this is kind of a long question, but it should be a pretty short answer. Have you ever noticed a period of time in your life where you had very high energy, low need for sleep? You may have been making impulsive decisions. Maybe your family was worried about you because you were just like kind of like wired, people will say sometimes, with energy.
No, I would say I've always been pretty even keel, pretty even mood.
Okay.
I not had a lot of these ups and downs in mood. That's why this is so different and concerning to me.
Okay. Now I'd like to talk a little bit about anxiety. Do you feel like you have any anxiety on an average day?
Well, I worry all the time. I'm always worried about, my family's health. It's such a strange, dangerous world to me now. And my son is gone, there's so much I can't control now. And I just worry about him all the time. And I went to the emergency room because I had so much, my heart was racing, my chest was tight, and they didn't find anything physically wrong with me.
Okay. What about your memory? Do you feel like you're having any issues with memory or recall?
Yeah, my concentration isn't very good at work. I just, my mind just wanders off so much. Okay. I can barely focus on what I'm trying to get done in a day there.
Okay, so what about hallucinations? Do you ever feel like you hear or see anything that's not there that other people aren't hearing or seeing?
No.
Okay. Okay, so it seems like you're having some depressive symptoms, so I just want to ask you a few more questions about that.
Okay.
Do you feel like you've lost interest or pleasure in doing things you used to enjoy?
Yes. I can just sit and stare, and all these things I love to do, I just have no motivation or energy to do them. And even if I do them, I don't get the same little boost from those activities that I used to.
What about guilt or hopelessness?
Yeah, there's definitely that. There's some hopelessness. just don't know what's going to happen in the future, and I just worry about it, especially with my son.
Okay, and you've already kind of answered about energy and concentration. Both you said were low. You're struggling with both of those.
Yeah, I always feel tired, even when I do get a little sleep. I'm just tired.
Okay. What about your appetite? Do you feel like you're eating okay? Are you eating more or less than usual? Losing weight?
No, I think I'm eating more. I think I just eat like to try to find some pleasure, and it's kind of like comfort eating.
Okay. Have you gained a weight recently, more than 10 pounds?
Yeah, like 20.
Okay. Okay. Have you ever felt like you wanted to hurt yourself? Any suicidal thoughts?
No, but I sure thought I was dying when I had all that racing heart and chest pain. I thought I was having a heart attack.
Okay. What about, have you ever engaged in any self-harm activities purposely? Have you ever cut yourself or hurt yourself to release some tension and make yourself feel better?
No.
No, okay. What about, is there any guns or weapons in the home?
Mom, my husband does have like a hunting rifle. It's locked up
Okay.
in his cabinet.
Okay. Have you ever felt like you wanted to harm anybody else?
No.
Okay, so what about a psychiatric history? Have you ever been diagnosed with a psychiatric condition?
Yeah, years ago when my son was small, I had some depression and I was put on Xanax.
Okay.
And I took that for about a year, and it did help.
Okay.
But then I felt like I didn't need it anymore, and I did pretty well without it until now.
Okay, so were you seeing a psychiatrist or your primary care at that time?
My primary just went ahead and prescribed it.
Okay.
So I haven't had psychiatric care before.
Okay, so you've never been hospitalized for a psychiatric reason?
No.
Okay, what about your medical history? Any significant medical history? Diabetes, hypertension?
No, one doctor did tell me that I might have fibromyalgia,
Okay.
but I just never really had any physical symptoms before all this like mental anguish started, so I just wonder if it's more that.
Okay, great. Okay, so I just want to take a little bit of social history here. Do you use any substances? Do you use any illicit drugs?
No.
What about marijuana?
No, I mean I have, but certainly not regularly or even I haven't done that in a long time.
Okay, when would you say you used it last?
Oh gosh, years, 5 years or more.
Okay. What about alcohol? Do you use alcohol?
Yeah, socially, I sometimes find myself trying to reach for a drink now to get rid of all the worry and stress and trying to boost my mood and be happy.
Okay, yeah. How many drinks do you think you're having a week?
I probably drink once a week on a weekend. I would have had like a glass of wine with dinner, but now I find myself maybe wanting 2 or 3.
Okay. Do you ever have more than 6 drinks in one sitting?
No.
Okay. Has anybody told you they're concerned about your drinking?
No.
No. Okay. Tobacco use?
No.
Do you smoke or use tobacco? Okay. What's your highest level of education?
Oh, I have a doctorate.
Okay. And are you currently working?
Yep, I'm working.
Okay, what do you do?
Well, right now I'm just kind of working part-time as a paralegal, even though I have a law degree, because my son, I just was always so involved in all of his activities and sports that it just was a better fit to be a paralegal and not take on a huge career challenge.
Right.
I was so involved in raising him, and now he's not in my life much.
Yeah, okay. What about your childhood? Anything traumatic happen in your childhood or any trauma in life?
No, I would say just the normal ups and downs, and we all lose people here and there, and I would say nothing overly traumatic.
Okay, great. What about your family? Is there any history of psychiatric conditions in your family? Mother, father, siblings, or grandparents?
My sister definitely has some anxiety. She's been on anti-anxiety meds for years, but it works well for her, and she's very functional. And my mom is a constant worrier too.
Okay. Okay, great. Now, before I go ahead and let you know what I think that I'm going to do for you to help today, do you have any questions or concerns for me? Yeah, good, I think so.
No, I just I'm a little nervous about taking mental health medication. I hope I'm not like I'll be dependent on it forever. It's a little thing that I worry about.
Right, I can understand that. So the first thing that I want to do with you is I have some questionnaires for you. I'm going to give you a questionnaire that relates to depression.
Okay.
It's called the Patient Health Questionnaire, or the PHQ-9. It's just going to go through some of the things that we talked about today, and it's going to go ahead and rate the severity so I can see where we're at with that. And then I'm also going to give you a generalized anxiety disorder questionnaire. So they're both just survey based. You'll just answer each question on the paper, and then we'll get a good feeling for kind of what's going on with your symptoms and the severity and what we can do to help you.
Okay.
I'd also like to draw some baseline labs, okay, because this is the first time I'm seeing you. So I'm going to go ahead and draw a CMP and a CBC. Those are just basic labs that tell me a little bit about your chemistry and your blood counts. You probably had them done at the doctor before. They might just call them like basic lab work.
Yep. Okay.
I'm going to go ahead and draw a TSH and a T3 and a T4. And I would get a CT scan, but I see you had one a few years ago for headaches, and that looked to be okay. So we won't repeat that today. But I want to just make sure that there's no medical reason for this rise in symptoms, okay, before we were to start mental health medications.
Okay.
And then if all of that looks good and your results are within what I am anticipating, I would like to start you on a drug called Zoloft.
Okay.
It's an SSRI medication. What it is an antidepressant. Okay, you're going to take it every single day in the morning. Now, the thing about Zoloft is it does take quite a long time to work. It can take up to 6 weeks to be in full effect.
Oh, that's good to know.
Yeah.
Because I would just think it wasn't going to work for me.
Yes, some patients do that, so we really want you to stick with it, okay? You may have some relief after 2 weeks, but really the full 6 weeks is needed to have it therapeutic for you, which means working.
Okay.
I know that can be hard sometimes to hear you're going to have to wait so long with relief. So what I'd like to do is write you just for a very short-term prescription of the Xanax that you said to work for you, but I want you to understand that this is a short-term medication. It's not something we like to use long-term. I know you were on it for a year before. I'd like to see us get off of it and just be able to do the SSRI.
Okay.
But when you're having these panic symptoms, like your chest is tight and you feel like you're dying, that would be a time to go ahead and use that medication while we're waiting for the other one to kind of start to work in your system.
Okay.
Okay. So side effects for the new medication for you, the main one with Zoloft is GI upset. So it could be a stomach ache, it can be some diarrhea and some nausea, okay? Don't stop taking it if you have these symptoms. I'd like you to call the office. Many times they resolve with time, and if they're not too severe, I'd like you to continue the medication, but if they are, we'll just have you come back in and we'll try to find something that works a little bit better.
Okay.
Okay?
I can tolerate that.
Okay, great. And the second thing I want to do is actually attached to our clinic, there's a really great psychotherapist, it's a psychotherapy center. So I'd like you to go ahead and start some cognitive behavioral therapy. So cognitive behavioral therapy is a big word for talk therapy.
Okay.
So I think with the medications, and while we're waiting especially for this Zoloft to start to build up in your system and work, I think that you'll benefit from that. And you'll be able to get kind of your feelings out about your son and have someone to connect with.
Oh, that would be good.
Because
my husband just doesn't always get it, and
yeah, I can understand that. Now, everything we talked about today is confidential. I won't share it with anybody else, okay? Unless there was a major safety concern, like you told me that you were going to go home and hurt yourself, then obviously I would act to go ahead and help you. But if it's okay, I'm going to go ahead and bring your husband in now, and we can kind of talk about the plan and kind of get him involved in their care so he can help watch you and make sure that you're doing well with the plan. Is that okay with you?
Yeah, that's okay.
Okay, great.
Sure.
Okay. All right. Thank you.